Welcome, Year 12. My name is Shabi Kata. I'm one of the academic in a nursing program in UEL. I'm going to talk a bit about my background. I am a nurse at background. I was working in ITU, so intensive unit care and INE, for several years. And then I've done the move to academia, where now I'm a lecturer in a nursing program. As you can hear, I'm not from UK, I'm from France. So I moved in UK about 5 years and a half ago, something like nearly six now. And then this morning I'm here to talk about the nursing program and nursing associate to show you a little bit what we propose and what are the difference. We're going to talk a little bit about the university, what the program is, what kind of module we do. And then I have questions from you already. So I'm going to answer those questions and we'll be more than happy to take additional questions. So like Lauren said, I've put a web address on the first slide. If you can log into this and you will have access to questions at the beginning of the presentation. It's just about getting something a bit interactive and have a look at your thoughts about nursing already, and then we can start the presentation. So once,
Sorry,
yeah,
students are getting to that website. It says they have to log in. Is there a username or something?
so they need to pull.
Oh, you can skip it. Okay, so
Yeah,
you can skip it. Okay, thank you. Someone's just said
no
they can
problem.
skip over
Thank
that.
you.
Thank you.
Brilliant. Everyone is logged in. Can I put the second slide?
Okay, most of us are logged in.
Brilliant.
It's got a. So don't do anything else yet. They're just on the first page.
Yeah. Thank you very much. Okay, so I'm going to get on the second page, and that is a learning outcome. So today we're going to look at understanding what is a registered nurse and what is nursing associate. We're going to look at identify the potential professional development career, understand the different programs and entry requirements, and acknowledge employability and salary for nursing. So we're going to start with what does nursing mean for you? So that's where we're going to be on the interactive side of the presentation. And that's where you need to be on your computer or on your phone. So I'm going to open it. And you need to let me clear the response. There you are. So now you should have access to the first question, and you can put in 3 words that you think when you hear nursing. So you go into where I ask you to be, and then you write names. Hey, you're brilliant. So we're going to see the words on the screen, and bigger is the word, more often you wrote it. Good, caring, and nature's compassion. Wow, good. This is brilliant. Good communication, yes. Blood, yes. We got big caring here, lovely. Compassion, competence, yeah, definitely. Treatment, yeah, that's part of the job. Hardworking, competence, wow. This is quite impressive. Empathy, pathetic, wow, really good. I can see you've done some work here. Compassionate care, support, resilience, really good. I'm just waiting until it settles a little bit and then we can go to this next question. Holistic, wow, brilliant. Needles, yeah, we do some. Hospital, yeah, patients, services, communication, yeah, very important. I can see a little overworked here. Brilliant. Okay, seems settled now. Okay, I can see you have a lot of good thinking about nursing already. I can see you've done work on that. This is brilliant. You have a really good knowledge already. Perfect. I'm going to go on a second question. and then again you will be asked to answer. So being a nurse, you can become, and you need to choose the answer you think correct for you. Okay, so we go a doctor, bedside nurse, yes, prescriber, a manager, yeah, okay. Cool. Always getting a lot about all the above. Okay. I like to see this one. God, at the beginning we got different things, and at the end we nearly have everyone on the last answer. Brilliant. Okay, thank you very much for that. Yeah, you're quite right. Cool. The next one. How do you feel about becoming a nurse? Cool. Brilliant. So we have quite a lot of people feeling quite happy about becoming a nurse. Brilliant. Perfect. Thank you very much. Okay, we got a lot of information here already. We're going to start about the first slide. Okay, so we're going to talk first about a little bit the university. So why UEL and what would we choose UEL to do nursing? So UEL, as you probably know, is in East London, and we are very close to our community in East London, and we have three campuses. So probably the most known one on Stratford is the Stratford campus. That's where we mainly based for nursing, and that's where we mainly do our skills and simulations. But we do also some teaching. We got another campus on Stratford, is what we call the Stratford Square. So that's the one on the right side, pretty new building. We use sometimes for theory, but it's probably the one we use the least of our three campuses. And then we have the third one, which is the Dockland one, with the one in the middle. It's quite new as well, and is on the Dockland. We have here quite a lot of our theory part and component of the program. Um, it's a really nice campus, to be fair. Here there it's got a massive library on the view with the river. You have a sports center, you have a lot of facilities, cafes, restaurants, and Stratford campus and Dockland campus are linked with a shuffle. So we got a bus going back and forth every half an hour, and it's free for students, so we can move between campuses quite easily. So that's the three campus we use. Mainly we will be on the Stratford campus and the Dockland campus. So UEL, as I said, is in East London, and we are very close to our community, and we try to provide a university services to our community to help our community to get graduated to degrees and to do what they want to do and to have the career they want to have. Um, we are a career-led university. What that means is from the day one you're coming in our university, we're already looking at your career, and we are meeting you. We are giving you access to our partners. We are giving you access to services to already think about what kind of career you want, what you can do, how you can develop. So we are not only looking at the academic side of it and being graduated, but we're already starting looking at your career afterwards. So here I got a little video. I'm going to talk through the video. It's about our skills labs and simulation center. So we're going to see, I'm going to play it. We're going to see what kind of facilities we got at UEL to do skills in nursing. So we have an entire building that is only for simulation and skills. So we are in the Stratford campus here. And when you're coming in, the building just in front of you will be the CE building. And that's where we do our simulation and skills. So you need to come in by the side, the right side, and then you need to go up. Is on the first and second floor of the building. Here we're going to go straight to the second floor. It's probably the rooms that we are using the most for our simulation and skills. You will see we have done some work and more work is coming to soon because we really want to have a really good experience when we do skills and simulation because it's quite an important part of nursing. So here we are getting on the second floor where you are coming in our simulation center. So the first room here, CE201. So we badge in and we go all the equipment you will find in hospital. So all the hand washing equipment, gloves, we got our crash trolley and red here. We got Oscar here. We got a drug trolley. We got lots of beds. We got mannequins here connected to monitors that we can change the vital signs and how the mannequins ears so we can play with the scenarios. We're getting two new mannequins very soon. We call the 3G mannequins, and we will be the only one in Europe to have those mannequins. We can do absolutely everything with those new mannequins. So we go child as well. We go mannequin for ECG, and we got an ECG machine. We go pumps. We got a lot of equipment we have in hospital, and we use them in our simulation and skills to make sure when you are coming and going to hospital that you know already the equipment and you know what it's for and you know how to use it. So sometimes we do some presentation on skills lab as well, but mainly we would do practical, is 99% practical in simulation labs. So we're going to go in the second room of the simulation center, the 203. So here on that room, we have simulated a flat because for us it's quite important to teach in hospital settings, but not only, because as a nurse, some will be working in hospital, some will be on community. So we need to teach also how to care for people in a community setting. So we have like a flat. So we have a room, we have a kitchen, the appliances are coming, and then we have a bathroom as well. And then we can think about how we care at home, because as you can think, it's not the same way to care because we don't have the same equipment, we don't have all the equipment we have in hospital. So that's why we use that flat. That's another room. So this one is what we call the ITU room. We are getting more equipment for this. We have two ventilators coming with the two mannequins, and we have a proper ITU room here to do simulation and skills for ITU settings. Then we go back in the corridor and we're going to go in another room, I presume, because we got another big room to do skills. So what we do usually, we got showers and changing rooms. What we do usually on simulation and skills, we divide the cohort to make sure we don't have a lot of students with us, like that we can concentrate on the skills and practice the skills all day. Cool, that's it for the skills lab. I hope you like this. Okay, so now we're going to go to what is a nurse and nursing associate. So you might have heard about nursing associate. It's quite a new role in nursing. I think it's been created in 2017, so like 4 years ago. We already have our first cohorts out and they are working as a nursing associate. But we're going to look at both and what the difference. Both roles are based on the same values and nursing values. I've just put few of them, but I think that is quite important ones. But there is more than that. But we talk about, and you said it already. That's why I was quite impressed with your words, because you nearly said all the value we got here and all the important things about nursing: empathy, communication, caring, compassion, knowledge and competence, advanced skills, leadership, courage. So I was really impressed about the words you give me because is that the words I have as well. So they was really good. So during the program and during the nursing education, we're going through all those values and how to apply it and how to develop them as well. It's very important thing that we need to demonstrate throughout the 3 years of the degree or the 2 years of the foundation degree to be able to register as a nursing associate or a nurse with the NMC, with the Nurse and Midwifery Council. Okay, so that's things we're going to go back quite often. Here we are. So on the left side, you have what the platforms about nursing associates, and then on the right, you have what is a registered nurse. So the first difference between both is a nursing associate is a foundation degree, so it's 2 years at university, level 4 and 5, where a registered nurse would be 3 years with 4, 5, and 6. So we're going to have a few differences here. So both are accountable professionally. So they are registered with the NMC and they are accountable of what they do. Both are for promoting health and preventing ill health. Where we start to have a little difference here is nursing associates provide and monitor care, where the registered nurse will provide and evaluate. So we have with a registered nurse, we have a little extra on the care. They're not only providing and monitoring the care, they also evaluate the care and probably take action and make plans to make sure that the patient is safe and getting better. They're both working in a team, but the registered nurse will be more on the leading and managing side of nursing care than more than the nursing associate. They're both for improving safety and quality of care. And the nursing associate is about contributing to integrate care, while the registered nurse is a bit more about coordinating it and assessing need and planning care for patients. So that's a little difference between both roles, but they're very complementary and they're working together. They are really, for the skilled, for example, is quite similar. Then the registered nurse, we're going to have a bit more advanced skills, but they are really, really similar. So now I've put slides about professional development career you can have in nursing. So obviously you can be an healthcare assistant, you can be a nursing associate, or you can be a registered nurse. But anytime here you can jump in. So if you have the entry requirement for nursing associate, you can come in nursing associate directly. If you have the requirement for registered nurse, you can come in a registered nurse straight away. But if you don't have the requirement for registered nurse, you can start with nursing associate and then do registered nurse afterwards. So it's quite open how you do it and how you want to do it. One of the different as well I didn't say about with nursing associate, they work on the full field of nursing. So nursing associate, we work with adult children, learning disability and mental health. They can work on the full field. Where registered nurse, is more focused on one field only. So once you register nurse afterwards, you can be a nurse in charge. So there's a nurse who are in charge of the entire day and the entire ward, and dispatching what we are doing, who is doing what, and which patient. You can be a manager, you can be a nurse specialist, a nurse practitioner, a researcher, lecturer, practice educators, a consultant, or even a doctor in nursing. So we have a lot of things it's possible and we can do. And it go more than that. I couldn't put everything because it's so many. And probably when you're going to start as a nurse, you will be in contact with something you never saw before and you will be very interested and you can do this. So there's a lot of different possibility you can do, and that is only few example. So nursing is much it's wider than what we think, and you got a lot of career progression you can have here. So let's talk about entry requirement now. So for nursing associate and to be able to come in the foundation degree, you need to have math and English level 2, and you need to have a level 3 qualification or equivalent of 48 UCAS points. For nursing, for adult nursing, it's slightly different. So you need an English and Math level 2 as well, but you need a level 3 or 4 qualification equivalent at 112 UCAS points. So if regarding what qualification you have already, then you can know which one you can ask for. Okay. The program. So I'm going to start with nursing associate. As I say, is over 2 years. Is usually once or twice a week at the university. And then you have placement. I think for nursing associate is about 20 weeks placement a year, something like that. You have 10 theory modules throughout the 2 years and two practice modules, and each year is 120 credits. On the right side, I've put the modules that we are doing for nursing associate. So you have developing as a nursing associate, professional values, bioscience for nursing, promoting health and preventing ill health, communication, nursing associate practice, pharmacology, teamwork, and for professional practice, evidence-based research, and patient safety and quality improvement. That's what we do in the 2 years. Okay. For nursing, it's over 3 years because it's a bachelor degree. And you do alternate university and placement periods. So what we usually do, go like term one is about theory, term two you go to placement, term three is theory, and you go back to placement. You have 12 theory modules throughout the 3 years, three module practice, and here as well is 120 credits per year. So the module on the right, you go law and ethics, bioscience, promoting health, communication, pharmacology, assessment management, prevention and acute and long-term physical and mental health condition, evidence research, based research, sorry, clinical decision making, civil engagement, preparing a registration as an adult nurse, advanced adult nursing skills and quality improvement and evaluation. So we do a little bit more on nursing because it is 3 years, and we have to go a little bit further because we have the leading and managing part of it and more advanced skills to do compared to nursing associate. But some of the module are pretty similar. Okay, now I'm going to go to the employability. Um, One of the big questions when you go on university is, am I going to have work once I've graduated? Is it easy to find work in what I want to do? And in nursing, we're pretty good because in the country, so in UK, university an average of 97 to 100% of employability. So that means once you've done your degree and you graduated, you have 97 to 100% of chance to find a job, and very quickly. Across the NHS, we have 43,590 nursing vacancies, which is absolutely huge. Only on London, we have over 10,000 nursing vacancies, only in London. So we have a lot of employability, and usually our students find a job even before finishing their study. So that's quite reassuring, really, for afterwards. Now, very important point: the money, salary. How much a nurse earn? I have quite often the question. So I've put the salary here per year. Obviously, as you can see, it depends if you are in London or if you're outside London. The salary in London are a bit higher. So if you're a nursing associate, what we call band 4, so in NHS, I don't know if you know, but we have bending. So nursing associate is band 4 and the nurse start at band 5. And then with the years and your qualification, you can go band 6, 7, 8, 9, and so on. So band 6 is a senior nurse, band 7 is start to be quite a leader nurse, and then A above is more management and matron and things like that. So nursing associate, you can start in London about £26,000 a year. Outside London is about 21, nearly £22,000. For a registered nurse, you will start in London about 29,800 a year. Outside London is about nearly 25,000. So I just give you an idea about the salary you can expect when you're starting, and that is only at the start of the career. Every year you're going to have an increase of salary until you reach the end of the band, and then you can apply for the band above. And obviously each time your salary is going up. Okay, I have those sets of questions. I'm going to give you time after that to ask me a question, obviously, don't worry. But I'm going to go through those questions I had And then I can have more questions, and we have another video to show you. So the first question: what sort of virtual work experience could our students get involved in during lockdown? So that's a really good question. So with lockdown, we had to completely change the way we are doing our lectures and our uh, delivery. So we went to full online with lockdown. So everything was online on Teams, like we are doing today. Uh, and then we keep sending our students into placement. We've put in place a process to ensure the safety of our students to get to placement, so that we're going to placement. Now it's getting a bit better with COVID, and we are allowed to go back on campus. We're already coming back to campus, and we do what we call dual delivery. So we have half of the cohort in classroom with us doing the lecture, and half of the classroom online. And every week we swap the groups. Skills now is on campus as well. So we started again the simulation and skills on campus, which we're really happy with it. Um, Second question, what other things can students do to help with the application? So the application on itself is, I think, is quite straightforward when you go on UCAS or directly on UEL. I think what is important, and that is for application and interviews, because I think you have another question about interviews, is about being aware what nursing is about have a read a little bit a bit of search about nursing, about the nursing council, the NMC. You have a lot of resources there. You can read about what is nursing, what to expect. Um, is having a little bit of read about the program, about what is nursing as a profession. So recommendation would be have a look a bit on internet, read about it. NMC is a really good resource because that is our regulatory body. So is that the gold standard of information about nursing. And then you have the code of nursing. You can have a look. You have a paper about the program, about being a student. So you have a lot of different PDF. You can look at it before interviews or before your application, just to get an understanding about what is going to be. Any useful resource that you can research, I just answer that. What sort of grade will they need to achieve to progress on the? Okay, that's a really good question. So to progress, you need to pass your modules, and to be able to pass your module, you need to have marks above 40%. So 40% is a threshold. Over 40%, you pass your module. Under 40%, you fail your module. You need to do it again. So you need to have at least 40% grade to pass the module for level 4, 5, and 6. Uh, how can students mentally prepare for the transition from the colleague? That's a really. I had exactly the same question yesterday in interviews, so that's interesting. So I know, and I was in the same place before. When you come from college and you go to universities, you feel like it's a big jump. You are going to like somewhere you have a bit less of structure, and so it's a bit stressing, and you're a bit anxious. I think to get ready for university, I think that one of the things is to get organized and to read about what is going to happen. So it's about your awareness about the nursing program, what is going to be, what's going to happen, what we're going to do. But it's also being organized when you start university, and you have things ready and prepared for your first year, for example. And I think one of the big things is the communication. If you are stressed or anxious about it, talk to your lecturers, talk to the staff is here. We are here to help you and support you to have that transition. Okay? Do not think you are alone on your side. You are not. You're going to have a lot of lecturers on the first year, and you have to have. You're going to have allocated lecturers as well. So you're going to meet very regularly. Talk to you lecturers and the staff member if you feel like it's very stressful. Communicate with us, and then it's going to be much easier for you. Any tip for interviews for when students receive this, and what sort of things they should be writing on the UCAS application? So I talk about that a little bit. UCAS application, I think, is about why you want to do nursing and what you're applying for the course. So it's about you're feeling about it. What is the reason you want to be a nurse? On the interview, it's kind of the same thing, but you have to talk through it. So it's a lot about your awareness about what is going to come. So I think you need to read about the program. You need to read about the what is to be a nurse, and think and reflect about why you took the decision to become a nurse. Yeah, why you're choosing nursing and not another profession? Why nursing? I do nursing. Why nursing associate and not the reverse? Or why nursing and not social worker? Why you make that decision? Okay, good. I think we can watch the video now, and then I can take the questions, the extra questions. So I can give Lauren. Are you still here?
I am, yes.
Brilliant. Do you mind to share your screen and show the video about nursing, please?
Yeah, absolutely.
Thank you so much.
Just find the video. Okay, I'm just going to play the video, but please do let me know if you can't hear the sound for any reason.
We can't hear it.
We can't hear the sound.
Have you done it so that you've shared it with the computer audio?
Yeah, before you share the screen, there's a bit where you have to add the audio bit.
You
so
need
that
to
we can hear
tick.
it.
Yes, that's right. And sorry, I didn't do that. So I'm so
worries.
glad you guys have told me. Thank you. Let's try again.
So virtual teaching.
Include computer sounds. There we go. Right, let's try again.
I've been nursing for about 10 years now, and from when I came in to what I'm doing now, I'll be honest with you, I never dreamed that I would be doing what I'm doing. And I don't think nurses now are being stopped, we're being encouraged to take on further roles.
I think you build on the blocks of your nursing, of being caring, compassionate, being a patient's advocate, understanding how vulnerable they are. But then with the additional skills, you can step up to care for them.
My role is I work 70% clinical, which means that I'm out and delivering care, and 30% of my time will be non-clinical, where I may be involved in education, research. I think that adaptability is key, really. I would hope that competence is key too, but you have to be adaptable.
A lot of patients do an experience to diagnose what they have. I have to assess, so I watch what they're doing, I watch if they've been talking, I watch if they're walking. What I do with the patients is something called motivational interviewing. It's the patient opening up about how they feel about their health and what I can do with them. As a modern nurse, I know for sure that I've helped many patients keep them out of hospital because of the knowledge that we've acquired.
I care for the patients across their whole surgical pathway. So I see them prior to their surgeries, I make the diagnosis, I build the relationship with them at that point. I also then see them in theatre. So to have a consistent person who they know and who they're familiar with is very reassuring to them. And then I also see them in the post-operative phase, make their management plans, lead them to discharge, do telephone follow-ups, see them in clinic.
We often refer to ourselves as being in intensive care on the road, but the same standards apply, because everything we do has a consequence, and we need to be able to pick that up through our evaluation. And so the decisions that we might make from there is to instigate a certain medication in order to bring about a level of stability. I always like to think that we're there to expand the team. What we're doing is bringing an intensive care element to that team as well. So we're very much about working alongside them.
When I went for my nursing interview and they asked me what I wanted to be a nurse, I said, I wanted to make a difference. During discussion, it'll come out sometimes about any specific innovations that they're doing in their clinical practice that keeps me abreast of what's new and what's out of there, and then could potentially bring that back to our hospital.
My patients need to be the centre of my care, because it's not about me, it's about the patients.
I think for me, the best part of being a nurse is that I am constantly learning, and I don't think there's ever a day that I don't go out and learn something new. And I think that we are very fortunate. There are not many jobs out there where I think people can say the same.
Thank you, Lauren. Okay, I can see that I have question on the chat. So, for registered nurse is training 3 years. Yes, registered nurse is 3 years. Nursing associate is 2. Are the working hours similar for nursing associate and registered nurse? Yes. So at work, so if the working hours and like for in hospital and NHS, we are working about 37.5 hours a week. So it depends if the ward, for example, is working at 7.5 hours a day or 12 hours a day. If they work at 7.5 hours a day, then they're going to, the nurse is going to work 5 days a week. But if they do 12 hours a day, then they're going to work only 3 days a week because the hours are done. So it's 37.5 hours a week. What type of question will be asked at the interview? Good question. So obviously I can't tell you the question we are using, but I can tell you to read about nursing and to think about why you want to be a nurse. That is kind of the important things we were looking at for the interview, obviously. And so read around that and think about and be aware about why you want to be a nurse. Does being a registered nurse mean you can qualify in both adjunct and really good question? No. So that's the difference between nursing associate and registered nurse. So the registered nurse do their education in one field only. So we have 4 fields of nursing. We have adult, children, mental health, and learning disability. And each field in registered nurse is different. So in UEL, we do only adult nursing. But if you want to do all the ones, so child, mental health, and learning disability is another course. So each degree is different, and they do the 3 years in that field. Where nursing associates, they do 2 years, but they are doing the full field of nursing at the same time. So the nursing associate will be able to choose where the person wants to work, or adult, or children, or mental health, or learning disability. Is the UK registered nurse qualified, recognized abroad if anyone wants to work overseas? So yes, so now with the Brexit is a really good question. I don't know the answer about it, but it was recognized in the entire Europe, and it also have kind of really recognition in Australia, in America. But all the things you need to have a little exam, I think, just to for some of the countries. But you with a UK degree, you're in a good position to work abroad. Our degree nursing courses get their study funded. Yeah, so yes and no. So you can some of the funding is coming back, and then you have to ask for student finance to get a loan to fund your study.
Shabby,
Yeah.
sorry, can I just jump in there
Yeah.
on the question of student finance? So I can actually offer a more detailed talk, or I can come in just for kind of 15 minutes some other time if you want some more detailed information, because I think we could talk a long time about student finance.
Yeah.
But just in terms of headlines, there is something called the NHS Learning Support Fund package, which has just been relaunched. It was relaunched in September 2020, and certain courses are funded, but that sort of is depending on kind of need, and there are additional, I guess you could phrase them as bonuses, depending on certain areas that are lacking certain professionals as well. So there's kind of regional incentives. So I could certainly sort of give more information about that, and signpost to some information around EU funding as well. As Shabby said, you can also apply for student finance. So that student finance is in addition to the Learning Support Fund. And there is additional pots of funding available for those who perhaps have independence, who are carers, but also things around disability support. So yeah, I'd be more than happy to talk about that in more detail another time.
Lauren, do you know if the EU citizen are still funding by this or no? Because I know we had a discussion about it and I haven't had the answer yet.
Yeah, so just in brief, if a student has been registered as, I believe if they've got sort of EU status for the last 3 years, then they can still get funding. But I would just have to check my information
Cool.
and I can provide kind of more correct information at that point.
Brilliant, thank you, Lauren. Next question is about midwife. So it's a completely separate course. Midwife and nursing is completely separate from the beginning. So if someone wants to do midwife or want to be with midwife, then you will have to look at the midwifery programs, which is completely separate. Any other questions? I hope all of that is helpful.
Are there any questions from year 13? I appreciate you might not be sort of adding to the chat, but if you want to turn the mic on in your classroom, then you're very welcome
Year
to.
13, I can see you. I can see you. We
So
haven't
can I.
we haven't got any more questions here from year 12s.
Okay, great. Year 13, just a sort of word of caution, or not a word of caution, but a kind of call to action, should I say. Student finance applications are now open. So if you haven't started your student finance application, I would really urge you to do so that those of you that have applied to start in September 2020 have your student finance in place. The process is it estimates that it takes about 6 weeks, but you can imagine that with the tens of thousands of applications coming in and sometimes additional evidence that's required to either sort of prove status, whether you're estranged from a family or whether it's kind of getting information on parents' household income, then that can delay the process as well. So you don't want to be there in September starting your course and find that there's no money in your bank account. Okay, so I would really urge you to start your finance application. If you guys want a more detailed talk, you want to be shown how to start your student finance application and want more information on that, again, that's something that I can provide. So all you have to do is let me know.
Yeah, that would be great. I'll get in touch with you to organise that. I think that'd be really useful.
I have also, I think, Lauren put some links in the presentation.
Yes, so I can go through those. And actually, I just thought of something else that I was going to highlight about student personal statements. Again, that's a talk that we can provide, so we can kind of go through the structure and give tips and advice about how to get started. Shabby mentioned that you want to include in your personal statement that information around sort of why it is you want to do that course. Now, just try to think how you can make your application stand out there. You can imagine if you start a personal statement and for the thousands that our admissions tutors and our academics are reading, saying, I've always wanted to care for people. That's not original, and we need to see you expand that kind of desire and where did that passion come from. We often sort of read statements like, ever since I was born, I've wanted to become a nurse. Really? From the moment you were born? Let's think about that practically. So just kind of sense checking your personal statement. But again, that's something that we're more than happy to provide further support. Shabby, did you?
Yeah, that would be great as well, I think. They're going to be writing their statement soon.
Excellent. Yeah, I think it's a good idea to get started just drafting before the summer holidays. You really need to get that started nice and early because you want to be prepared to do draft upon draft upon draft.
Thank you, Lauren.
Just one very quick question about statements, because the students would have normally been able to talk quite a lot about their work experience that they would do in year 12, but they haven't been able to do that due to restrictions. So they're doing quite a lot where they're trying to get experience of doing online courses and webinars and things. Is that the kind of thing they should be writing on their statements? Because they won't have the actual work experience to talk about.
I think, Shabby, you've touched on this before, haven't you, in terms of what you're looking for students' experience of caring examples and where you might have delivered.
one is about caring example or example where you help people. It can be a really wide thing. It's not only about the healthcare settings. It can be in the life as well. You had something, you help someone in supermarket, or you help some. This is helping. This is caring as well. You don't have to have an healthcare experience to give in your statement. It is about caring and helping and supporting people on a wider spectrum of it. It can be on a day-to-day basis, really. It doesn't have to be very specified of the healthcare system. Doesn't.
So could they add like anybody they supported through lockdown?
Absolutely.
Yeah,
Great
absolutely.
example.
Yeah, definitely.
What we want to see is sometimes we've used the kind of technique, the STAR method. So situation, task, action, result.
Yeah.
So we want to see what it was that you did, the action that you took, and what was that final result. So you can see that worked example.
It really can be anything that is demonstrating, supporting, helping, caring. It can be anything. If you have peers or your colleagues with something in school and you help them, you're supporting them, that works as well. It can be really like anything that demonstrates your care side, how you help people, how you support people. It's really wide.
Shabby, could you just go to the next link for me, please?
Yes,
The
definitely.
slide, sorry.
This one?
Yes, thank you. So I just thought I'd leave this up so you guys can start to complete it. So if you take a picture of this QR code, it'll take you to an evaluation form. Hopefully we have answered all your questions today. I'm conscious that we're swiftly running out of time. But if we haven't answered everything, then this is the opportunity to tell us, and we can feed that back with your teachers and arrange for future sessions or get those answers sent to you. The other links I'm going to pop in an email to your teachers so that they can share it with you. But we had information there with regards to additional support that you can access. So when you're at a university, it may be that you've got dyslexia, you might have had a diagnostic assessment for dyspraxia. There might be other learning challenges. You can get additional support for that at university, including mental health support. So do check that out on our website, but it's applicable to any institution that you'll be studying at. And we've mentioned student finance already, but do check out, even if it's not the University of East London that you have applied to or are interested in applying to, look at the university's websites because they have information on extra pots of money, whether it's bursaries or scholarships, that you might need to apply for additionally to that sort of central student finance application process. So definitely do your research. And hopefully by giving your feedback as well, we can identify in any other areas. We do have on the university's website details of other events that we're running, whether you want to join in, whether it's different subject areas. And there's also an online careers tool, it's called our online careers coach, and you can do a quick quiz. So you might be like thinking, oh, I'm not sure if nursing is right for me. I could go in many different directions. So by all means, fill out that quiz and that might give you an idea of kind of where you might see yourself in the future.
Thank you so much. That was really helpful. Thank you.
you.
Thank
Yeah,
you.
thank you so
Thank you,
much.
everyone.
Thank you.
Thank you very much.
Thank you, and we'll be
Have a
in
great
touch.
Okay, I'll be in touch. Thank you.
Thank
Bye.
you.